Get my PTA off your back here. Alrighty, how are you doing today, Zach?
Good.
Good. Okay, so first test we're going to do is called a PA test. It stands for posterior to anterior. We're going to apply some pressure onto your back, pushing your spine forward towards the table, okay?
Yep.
This test can be used to check the mobility of the spine, to check for recreation of pain or symptoms, and to also be used as a treatment for some pain in the back there. And if the back was hypomobile, we could use that to rule up the classification of low back pain with mobility deficits. So the first thing we're going to do here is find the iliac crest. That'll put us in between L4, L5. Feeling that bony prominence right there. It's L5. I want you to let me know if this feels okay or if you feel any recreation of pain here, okay?
Yep.
Okay. Feel okay?
Yep.
Perfect. Coming off of that, we've got L4. Feel okay?
Yep.
Moving up another one, we at L3. And does that feel okay?
Yep.
Awesome. Okay. Moving on to our next test, it's going to be one of those neurodynamic neurological tests. We're going to be checking to rule up or rule down radiating or referred pain. What we're looking for is a recreation of symptoms of that sharpshooting pain down that leg, or to see if that doesn't happen. Our first test, I'm going to bend your knee here. Perfect. Feel okay here?
Yep.
Let me know if at any time throughout this motion you feel a recreation of that pain that you were telling me about, okay?
Yep.
Perfect. You can relax your foot on my shoulder right there, and I'm going to lift you up. Feel okay?
Yep.
We can hold this position for 30 seconds, just looking for recreation of that pain there. And that would be a positive test for the referred or radiating pain. Awesome. I'm going to have you lay on your back for me real quick. Next test is our straight leg raise or SLR test, also testing to rule up or rule down that radiating or referred pain. I just want you to relax your leg here. I'm going to do 100% of this motion. You just get to lay here, okay?
Yep.
Perfect. I'm going to lift that leg up nice and straight. Point your toes towards the ceiling for me real quick. There we go. Feeling okay so far? Knees starting to bend right there, so we'll hang out here. How does this feel?
Feels fine.
Feels fine. No recreation of that pain. Okay, now I'm going to dorsiflex that foot. Just let me know if that changes how we're feeling, okay?
Okay.
Feel okay? No recreation of pain or symptoms? Alrighty, now I'm going to have you lift your head off of the table for me, just closer towards your toe. How about now? Okay, feels good. That would be a negative test. I'm going to have you sit up and dangle your feet off the side of the table for me. We're going to move on to our last test called the slump test. I'll show you really quick what this test kind of looks like. I want you to flex or bend forward towards your knees in your low and mid back here. You're going to bend forward. Then you can bend your neck as well, close towards your knee. I'll show you first. We're going to bring up that leg, looking for a recreation of those symptoms there while we're in that flexed position. Bring that head down for me. Staying in that flexed position. I'm going to have you bring your leg down really quick. I'm going to add a little extra pressure here. Perfect. Bring that leg up for me. How about now? Okay. Now that he doesn't have any recreation of symptoms, I'm going to have him dorsiflex. Bring those toes towards your nose. How about now?
Nope.
And if he did have recreation of symptoms, we could also have him extend his neck back, see if that changes the pain or makes it go away. Perfect. Next from my PTA.